Hello friends. So another video, it is regarding Hodgkin's lymphoma in children. It's a type of cancer found in children. Let's talk about this today. So before entering into the in-depth details of the disease condition, let us see the anatomical part of this organ called lymph system. It is otherwise called as lymphatic system, and it is a part of our immune system which helps fight infections and some other diseases as well. And the lymph system also helps control the flow of fluids in the body. And it is mainly made up of the cells called lymphocytes, a type of white blood cells. And again, it is divided into two types of WBCs. One is B lymphocytes or B cells, and T lymphocytes or T cells. So B cells make proteins called antibodies to help protect the body from germs, that is especially bacteria and viruses. And T lymphocytes or T cells, there are different types of T cells available, and some cells destroy the germs or abnormal cells in the body, and other T cells help boost or slow the activity of other immune system cells. And this is just about a brief about the lymphatic system. And if you see in our human body, the lymphoid tissues are present in various organs. It starts from adenoids, tonsils, thymus, lymph nodes, lymphatic vessels, spleen, stomach, colon, small intestine, rectum, and bone marrow. So these are the areas where you can find the lymphoid tissues, and it is connected together via the lymphatic vessels, and it is one way that the cancer spreads from one area to another, or one lymph node to the another lymph node via this lymphatic vessels. So as I mentioned, the organs involved in this disease conditions, one is the lymph nodes. Anatomically, if you see, it is a bean-sized collections of lymphocytes and other immune system cells. They are found throughout the body, including inside the chest, abdomen, and pelvis. They are connected to each other by a system of lymphatic vessels. And second organ is lymph vessels. It is a network of tiny tubules, a lot like blood vessels, and that connect lymph nodes and carry immune cells in a clear fluid called lymph. And lymph is collected from around the body and put it into the bloodstream. And third organ is about spleen. It is a part of immune system, and we know that it makes lymphocytes and other immune system cells. It also stores healthy blood cells and filters out damaged blood cells, bacteria, and cell waste debris. And again, bone marrow. This is the liquid spongy tissue inside the bones, you can see, and the new blood cells are formed here, including some lymphocytes. And when we talk about the thymus, it's a small organ behind the upper part of the breastbone and in front of the heart. It is important for T lymphocyte development. And adenoids and tonsils, you can find these organs in your oral cavity. These are collections of lymph tissue in the back of the throat. They help make antibodies against germs that are breathed in or swallowed. And finally, we have digestive tract, stomach, intestines, and many other organs also have lymph tissues. So when the spread happens or metastasis happens, so these all organs also will be affected due to this cancer disease, and it depends on the stage of the cancer. So when you hear or read about this disease condition first, Hodgkin's lymphoma, it makes very hard or difficult, or sometimes it makes people too hard think hard about the disease condition than actually it is, because of this name, Hodgkin's lymphoma. So it is named for Dr. Thomas Hodgkin, who in 1832 described several cases of people with the symptoms of a cancer involving the lymph nodes. So he is the first person named this disease because of he invented this or identified peoples with the same issues, and it was officially renamed Hodgkin lymphoma in the late 20th century. And we also observe World Lymphoma Awareness Day on 15th of September every year, and this day is dedicated to raising awareness about lymphoma among common population. Now let us see in detail about the cancer disease or lymphoma. What is lymphoma? So lymphomas are nothing but they are the cancers, and it starts in white blood cells called lymphocytes. So as mentioned earlier, there are two types of lymphomas possible. One is Hodgkin lymphoma and non-Hodgkin lymphoma. So in short, it is mentioned HL and NHL. So Hodgkin lymphoma most often spreads through the lymph vessels from lymph node to lymph node. Rarely late in the disease, it can invade the bloodstream and spread to other parts of the body such as the liver, lungs, and or bone marrow. So we have two types of lymphomas, Hodgkin and non-Hodgkin lymphoma. And if you see the causes of this Hodgkin lymphoma, there is no clear-cut evidence or the causes mentioned anywhere that because of this only Hodgkin lymphoma happens. But we have some scientific proof or the research-based evidences suggesting that infection with the Epstein-Barr virus sometimes causes DNA changes in B lymphocytes, one of the WBC type. And again, they are saying that in some cases, this leads to the development of Reed-Sternberg cells, which are the cancer cells in Hodgkin lymphoma. So this is the cell differentiate the cancer type, Hodgkin lymphoma and the non-Hodgkin lymphoma. Why it is called Hodgkin lymphoma? Because we can find this Reed-Sternberg cells in this type of cancer, then it is called Hodgkin. And if the cells are not found in the lymphoma, then that lymphoma is known as non-Hodgkin. So it is differentiated mainly based on the presence of Reed-Sternberg cells only. And again, it can be caused by DNA changes that turn on oncogenes or turn off tumor suppressor genes. These two are the healthy genes and support our body system, but unfortunately, due to the DNA changes, these genes fail to function normally. That leads to lymphoma. And red Sternberg cells also make substances called cytokines, which attract many other cells into the lymph node, causing it to swell. That leads to enlargement. In turn, what happens? These non-cancerous cells that release substances that help Reed-Sternberg cells to grow. So it is a mutual understanding. On mutual understanding, these two cells are functioning, and it is, helps the Reed-Sternberg cells to enlarge and grow further, and it gives the appearance swelling. We have some different types of Hodgkin lymphoma also. Mainly it is classified into two, known as classic Hodgkin lymphoma and nodular lymphocyte predominant Hodgkin lymphoma. These two are the major classifications. Again, classic Hodgkin lymphoma is divided into four subtypes. Those are, one is nodular sclerosis Hodgkin lymphoma, mixed cellularity Hodgkin lymphoma, lymphocyte rich Hodgkin lymphoma, and lymphocyte depleted Hodgkin lymphoma. These four are the subtypes of classic Hodgkin lymphoma. Let us see one by one. The first type is classic Hodgkin's lymphoma. So it accounts for more than 9 in 10 cases of Hodgkin lymphoma in developed countries. The cancer cells in HL, classic HL, are called Reed-Sternberg cells. So it is understood, as I mentioned earlier, these cells only differentiate the two types of lymphomas, Hodgkin and non-Hodgkin. Then these cells are usually an abnormal type of B lymphocyte. And enlarged lymph nodes in people with the CHL usually have a small number of Reed-Sternberg cells with a lot of normal immune cell around them. So because of this, Reed-Sternberg cells attracts the normal cells also, and that supports the cancerous cells. So these other immune cells cause most of the swelling in the lymph nodes. So lymph node enlargement happens mainly due to the coverage of this Reed-Sternberg cells by the normal immune cells. And if you see the subtypes of classic Hodgkin lymphoma, first one is nodular sclerosis Hodgkin lymphoma, or in short it is written NSCHL. It is the most common type of Hodgkin disease in developed countries, account for about 7 out of 10 cases, and most common in teens and young adults, but it can occur in people of any age. It tends to start in lymph nodes in the neck or chest. So this is the most common type of Hodgkin disease, nodular sclerosis. Second is mixed cellularity Hodgkin lymphoma. or it is written as MCCHL. So this is the second most common type, found in about 4 out of 10 cases. It's seen mostly in people with HIV infection. It is also found in children or the elderly. Also, it can start in any lymph node, but most often occurs in the upper half of the body. So for the understanding purpose, this human body divided here above diaphragm and below diaphragm for the easy classification on the staging purpose of the cancer. That's why it is written upper half and the lower half. And the third type of classic HL is it is lymphocyte-rich Hodgkin lymphoma. This subtype is not common, and it usually occurs in the upper half of the body and is rarely found in more than a few lymph nodes. Right, that's the third type. And fourth is lymphocyte depleted Hodgkin lymphoma. This is a rare form of Hodgkin disease, but it is very dangerous one. It's seen mainly in older people and those with HIV infection. It is more aggressive than other types of HL and likely to be advanced when first found. So though it is rarely happens, if it occurs, then it is a very complicated one. And is found most often in lymph nodes in the abdomen as well as in the spleen, liver and bone marrow. So it is about the metastasis spreading to other than lymphatic system or out of the lymphatic system. Now the second major classification is nodular lymphocyte predominant Hodgkin lymphoma. This type accounts for about 5% of cases, and the cancer cells in this type are large cells called popcorn cells. Why it is popcorn cell? Because they look like popcorn, which are the variants of Reed-Sternberg cells, and it usually starts in lymph nodes in the neck and under the arm, and it can occur in people of any age and is more common in men than in women. This type of HL tends to grow more slowly and is treated differently from the classic types. So the treatment options are different for both classification. First classification is about classic and second is nodular lymphocyte. Both are treated in a different manner that we will see in the future slides. Now types is over, then now let us see how to diagnose this lymphomas. Always it starts with the history collection and physical examination. Of course we have to do inspection, palpation, percussion, auscultation. Then go for the biopsy procedures, and 3 different types of biopsies can be done. One is excisional or incisional biopsy, needle biopsy, bone marrow aspiration and biopsy. So very detailedly I am going to talk about here all these procedures. And imaging studies also can be done. It includes chest x-ray, CT scan, MRI, positron emission tomography, and positron emission tomography PET scan is mainly the radioactive sugar will be injected intravenously and a series of x-rays will be taken to identify where the cells are located, especially because we know that the Reed-Sternberg cells are surrounded by the healthy immune system cells. So that area will be visualized if the patient undergoes positron emission tomography, then bone scan and the blood test. These are the other diagnostic procedures can be performed to rule out this lymphomas. Stages, and of course there is the classification and the stages for any cancer. It is possible. So here also lymphoma also can be classified, and according to the stages it can be divided, and which helps to the healthcare providers for the management of the treatment purpose. So here the staging system is a way for the cancer care team to sum up the extent of a cancer spread. The staging system used for Hodgkin lymphoma is the Lugano classification, which is based on the older and Albert system. It has 4 stages labeled 1, 2, 3 and 4. Here the difference is sometimes stages it is written stage 1E or stage 2E, which means for limited stage that affects an organ outside of the lymph system, the letter E is added to the stage. So example also it is mentioned, if stage 1E in the sense, for in limited cases it is the disease is spread or affecting the organ which is outside the lymph system. That is written in a short form. Okay, E letter, it is denoted in the letter E. So the classification is mainly based on Lugano classification. Let us see the classification. Stage 1. So either of the following means that the Hodgkin lymphoma is stage 1. So 2 things they have given. Let us see. Either is found in only one lymph node area or lymphoid organ such as the thymus. Or the cancer is found only in one part of one organ outside the lymph system, that is 1E, stage 1E. Either of the following. So if it is present, then it is stage 1. Then stage 2 is, again, either of the following means that the HL is stage 2. So lymphoma is found in two or more lymph node areas on the same side of the diaphragm. Either it is above the diaphragm or below the diaphragm, but it is on the same side, which is in the muscle beneath the lungs that separates the chest and abdomen. Or the cancer extends locally from one lymph node area into a nearby organ. So here stage 2E, because the organ which is outside of the lymphoid system is affected. In that case, it is termed as stage 2. And when it is stage 3, either of the following means that the lymphoid is stage 3. It is found in lymph node areas on both sides, above and below the diaphragm. If the cancer is found, then it is stage 3. And if it is in the lymph nodes above the diaphragm and in the spleen, also it is stage 3 only. Either it is above or below the diaphragm on both sides and diaphragm, above the diaphragm and the spleen, then also it is considered as stage 3 only. So in stage 4, it has spread widely into at least one organ outside of the lymph system, such as the liver, bone marrow, or lungs. So spread to out of the lymphatic system, which includes any one organ, then you can say that it is the patient is under stage 4 of Hodgkin lymphoma. So this is about the classification based on Lugano classification, especially to classify lymphoma into stages. This is the illustration. So the picture shows the variations above diaphragm and below diaphragm, or it is located in the neck or the chest, or below the diaphragm it is spleen, liver, and the other parts of the body where it is spreaded already. Okay, this picture illustration talks about all four stages. One more thing is that it is called bulky disease. What is bulky disease? This term is used to describe tumors in the chest that are at least 1 by 3 as wide as the chest, or tumors in other areas that are at least 10 centimeters across, about 4 inches the size of the tumor is. And it is usually labeled by adding the letter X to the stage. It is especially important for stage 3 lymphomas, stage 2 lymphomas, because bulky disease may require more intensive treatment. Okay, so bulky disease is nothing but it is the size of the tumor they are calculating, and it is another form of classification that can help the physicians or the surgeons to treat the disease in a better way. Now, coming to the treatment aspect, it is purely based on the stages. This stage based treatment is for the first classification, that is classic Hodgkin lymphoma. Okay, so stages 1A and 2A, and which is very favorable. This group includes Hodgkin lymphoma that is only on one side of the diaphragm, either it is above or below, and that it does not have any unfavorable factors. So what is this? How to understand this? For example, it is not bulky. So bulky means we know it is the size of the tumor is more than 10 centimeter or 4 inches, and it is not bulky here. And HL is in less than 3 different lymph node areas, less than 3 areas it is present, and it does not cause any of the B symptoms. And the ESR, erythrocyte sedimentation rate, is not elevated. In that case, it is stage 1A and 2A, which is favorable based on the stages. And stages 1 and 2 unfavorable. When we can say that it is unfavorable, this group includes lymphoma that is only on one side of the diaphragm but has one or more of these risk factors. The risk factors include bulky disease is present, the tumor is large in size, and lymphoma is in 3 or more different areas of lymph nodes it is located present, and there is cancer outside the lymph nodes called extranodal involvement, and is causing B symptoms. Additionally, the symptoms the patient develops and the ESR rate is high. In that case, the situation becomes unfavorable, and especially in the stages 1 and 2. And stages 3 and 4, this includes Hodgkin lymphoma that is both above and below the diaphragm and or has spread widely through one or more organs outside the lymph system. So generally treat these stages with the chemotherapy using more intense regimens than that used for earlier stages. So two types of chemotherapy drugs they are using. One is ABVD regimen and BEACOPP regimen. Okay, so ABVD regimen, that is for at least 6 cycles it is often used, but some doctors favor more intense treatment with the Stanford 5 regimen for 3 cycles or up to 8 cycles of the BEACOPP regimen. This is the treatment modality. Let us see what is this ABVD regimen and the BEACOPP regimen. ABVD regimen is nothing but it stands for the first letter of the chemotherapy drugs, known as adriamycin, bleomycin, vinblastine, and dacarbazine. So these four medicines or the chemotherapeutic drugs are included in ABVD regimen. And the second category is about BEACOPP regimen. BEACOPP also it includes the combination of 7 drugs, and they start this drug combination from day 1 2 and it extends up to day 15 also. Okay, you can see the first drug is cytoxan. You can see here the given as an infusion veins. On day 1 they are administering this one. The adriamycin, again that is for also day 1, and etoposide on day 1 to 3 they are continuing the medicine. Then procarbazine, that is for 1 to 7 days, it is given orally, and prednisone, that is also by mouth, that is 1 to 14 days, and bleomycin, intravenous injection they are giving on day 8 they are giving, and vincristine on day 8, that is also intravenous infusion. So this is the package or combination of 7 drugs included in BEACOPP regimen. So what we discussed in the previous slide, that is for the first classification, classic Hodgkin lymphoma. Now treatment for the second major classification, nodular lymphocyte predominant Hodgkin lymphoma. Again it is treated by chemotherapy drugs only. Here also we have ABVD regimen and additionally CHOP, that is cytophosphamide, doxorubicin, vincristine and prednisone, and CVP regimen, that is cyclophosphamide, vinblastine and prednisone. These are the regimens or the packages, chemotherapeutic drugs, combination of these drugs can be used to treat nodular lymphocyte predominant Hodgkin lymphoma. Finally, what happens? Survivorship care plan. What the patient has to do is suggested schedule for follow-up exams and test is mandatory, and a schedule for other tests might need in the future, such as early detection, screening test for other types of cancer is also advised, or test to look for long-term health effects from the lymphoma treatment, and a list of possible late or long-term side effects from treatment, including what to watch for and when should contact the doctor. And finally, regarding the diet and the physical activity suggestions for the patients. So these are the important follow-up recommendations for the patient who has survived this Hodgkin lymphoma.